Go.
My name is Troy Wall, and this is oxygen therapy and the closed chest drainage system. So first, we're going to do the oxygen. What we would do is check for the patient orders and see what is to be delivered. I'm going to introduce myself to the patient. Hi, my name is Troy. I'm going to be taking care of you today. We have an order for oxygen therapy. At this point, I would perform hand hygiene. I would come back. Depending on what the doctor ordered, we would set it up. This is a nasal cannula. It's used for 2 liters per minute to 6 liters per minute of low flow oxygen. If they were ordered, such as COPD, they would use this, which is a Venturi mask, which can be adjusted. It fits over the head, behind the ears, and these interchangeable pieces give a exact amount of delivered air. And there's multiple pieces that could be inserted. This is a non-rebreather mask used for 6 liters to 15 liters per minute. Most commonly, it's used for 6 liters to 10 liters per minute of oxygen. This is a non-rebreather with a reservoir attachment. You would fill this up with high flow oxygen. This is good for 6 liters per minute to 15 liters per minute, most commonly used for the 15 liters per minute because of the reservoir. So depending on the order, we'll start with the cannula. Sir, you have the order. What we would do is insert into the nares, around the ears. This patient doesn't have ears. And once it's secured on the ears, we would adjust the strap. We would plug into the oxygen and set for the desired flow rate. Next, we have our closed chest drainage system. We're going to be dealing with the wet system. So that there is a wet and dry. Most commonly used is the wet. This is used for anybody that needs drainage of the chest. As you can see, it's inserted in there. What we want to do is, again, we're going to introduce ourselves to the patient. Hi, my name's Troy. We're here to check on you too. Going to perform hand hygiene, come back with a clean technique. We're going to examine the site. We're going to just palpate gently around it. What we're looking for is any signs of crepitus, any crackling, anything that could show that it's not correct. We would check the order from the doctor. What we would do is fill the reserve up to 20. We would attach this to a suction and it would be turned on at whatever rate was there. This part here would be filled to 2 milliliters, and what we want to make sure is that there's a nice steady flow. If there's any constant bubbling, it means that there's a problem with the air leak. In that case, we would start at the wound incision site, and we would clamp the tube. We would continuously move down 6 inches through the tube until eventually the bubbling increases again, and then we know that that place there is a leak, and we would replace the tubing. To replace the tubing, the doctor would replace one end, this end would be placed in sterile water, and then reattached to the system. If a new system was replaced, we would go through the same system. The tube would be placed in sterile water, this would be swapped out, filled to the 20, filled to the tube. This system here is used for the reserve of the drainage that wants to be monitored every 4 hours. What we want to do is you can write your name, date, and initials, and as it fills up, you would record it to the drainage throughout the day. Once it's filled, you would replace the system again. You want to make sure that there's no kinks in the hose. You want to make sure that it's below chest level. And that's how we do a closed chest drainage.